Hello, I'm Lauren Zielinski. I am one of the second-year residents at Coastal Family Medicine. This is the clinic right behind us, and I'm going to take you on a little tour to show you where you'd be working during the day. All right. This is the front entrance of the clinic. This is where patients come in, and then there's a little drive here where they can get dropped off. Last year, when we were having more of a COVID peak, this was also outside where they would check in and they would drive in and do outside check-in, but we're not having to do that anymore. Next, I'll show you over on the side where we come in. This is the side entrance. This is where we all come in during the day. So let me put my mask on and I'll show you inside. This is the bigger of our two resident workrooms. This is Justin Lucas. Say hi. He's one of our residents hard at work. These are all computers that we use to chart or catch up on notes, things like that. We do have alcoves next to our rooms where we can work one-on-one with our medical assistants, and we do take advantage of those. But if we ever have too many people in clinic in one day for us all to sit out there together comfortably, or we want to do some teaching or catch up on things after clinic, this is kind of where we come to do that. You'll see all these boxes up top. Those are all prepared food boxes for our patients who have food insecurity. So we keep those in the clinic. We can give them to them the day of if they need it. This is our precepting room. So our precepting attending of the day sits there. And then this is where we come to present. So as an intern, the first half of the year, you present to the attending for every single patient. And then after that, you kind of just you come for the Medicare patients and then any other people that you have questions about during the clinic day. I'm gonna show you an alcove. This is one of the alcoves I was talking about where we can work one-on-one with the medical assistant, and that just helps a lot when they're right next to the rooms and we can chat about patients more immediately during the day. I'll show you one of our clinic rooms. We have, I believe, 14 clinic rooms in here. They all essentially look like this. So we have our beds, we have a little computer in the room right here. And then we have some of the more common supplies that we use in a clinic visit already stocked in here, but our supply room is very close if we need anything that's not in here. This room is specifically for OMT, or osteopathic manipulative therapy. All of our DO residents and then certain MD residents that are trying to get osteopathic recognition, which is one of our areas of concentration, will do our OMT clinic in here on Wednesday mornings. And so we can schedule any of our patients in here to see that select group of residents. And then lastly, this is our procedure room. So we have our ultrasound machine that we use Friday mornings in ultrasound clinics. We also can do some musculoskeletal procedures with that. We're starting to ramp up a little more of during procedures clinic. We have that 2 days a week. We do large variety of things in here, a whole lot of IUD insertion removals, same with Nexplanon insertion removals. We do colposcopies. That's our colposcopy machine right here next to the TV. That's connectable to the TV, as is the ultrasound, so that the patients can kind of see what's going on during those. We also do a lot of major joint injections with or without the ultrasound. And then just a lot of skin excision and type things too. But this is just a nice bigger room, so where we can have our residents, our preceptors, and often our med students with us as well. We do have a lab in here. It's got a few little machines that we can use in urinalysis. We have a couple of microscopes over here. So majority of the things we use that for are like vaginal wet preps. We can do those while the patient is still here. Ooh, let's take the elevator upstairs. Flawless. So over here we have most of our faculty offices, and they can come up and if we have questions we can come meet with them up here. This is Joy, our program administrator, and she just, hey guys. She does everything for us. She tracks our life on calendars and keeps us where we're supposed to be.
Yeah.
Hey. How's it going?
Yeah, hi.
This is Heather, our program coordinator, and she is awesome, and it is her birthday.
We like to eat around here, so I'm cleaning up today.
And we had a lot of food out today. This is our kitchen area, and it's kind of lunchroom, break room where we all come. Our interns are doing their also course in here right now, so I'm not going to interrupt that, but this is our big conference room where we have Friday didactics. If you want to just peek around the corner. Here we are at the Women's and Children's Hospital. So we'll start our hospital tour here and take you inside and show you a few places that we work.
Sure. We are at the Women and Children's Hospital, so when you're on your OB rotation, this is the main entrance. One of the places that probably has the best lighting. You've got art against the walls, you've got some trees, plants in different places, and it just overall has a pretty nice vibe.
Well, go. Come along. Come now.
All right, so down here we have an elevator that goes up to the Children's Pavilion, and then we also have the Lighthouse Cafe. So they've been doing a lot of changes to their menu to give us healthier options. So one of the best smoothies down here, better than the ones down in the cafeteria. Don't tell him I said that, but Miles knows what he's doing.
It's real and it's fruity.
They often have their menu, and then they have more menu options up here. The paninis are amazing. Breakfast options, especially when you're on OB, even when you're not on OB. Just a lot of options, small like flatbread sandwiches, omelets, the taco and burrito Tuesday, always come here.
Personal favorite.
Personal favorite for sure.
This is fun. This is very fun. Oh, excuse us. It's just some seating right next to Lighthouse where we can have food. Usually our lunches we'll do outside if the weather is nice.
Yeah, so a lot of times when you're on any rotation during your first year and you'll have your cat chats, you'll come out here for a lot of your lunches. Weather's usually pretty nice. Get a chance to like breathe for a second. You've got greenery around, the sound of the cars in the background, ambient noise, perfect, yeah. So yeah, pretty cool place.
Now we'll go to OB.
All right. So now we'll head up to OB.
So now we're kind of going in. This is where OB Triage is the emergency department for pregnant women, essentially. A whole lot while you're on your intern OB months, and then also a good bit on our inpatient months during senior years. We'll see patients down here that are 20 weeks or more, so for any sort of complaint that they have. So this is OB Triage. A lot of our time during OB months on intern year, you'll see patients in here. We also tend to see a good bit of patients in here on our inpatient months during second and third year. It's essentially the emergency department for pregnant women, so they'll come in for any variety of complaints. This is our OB call room. There's 2 rooms. This is for the attending, this is for us. And so whether we have an OB that we're watching, or if we just want to, like, are on the night shift or want to come hang out here on a weekend 24, it has a little bed in here, it has a little TV. We have an Amazon Fire Stick so we can watch TV if we want to. Justin has hooked this up to where we can watch our feel heart tracings up there if we are managing an OB while we're down here. It has a bathroom, which is really nice, especially while you're on a longer shift. If we go through this hallway right down here is where labor and delivery is. It's just this, it's with this one hallway, and there's, I believe, 32. No, there's 12 rooms, 13 rooms. How many rooms are there?
30 something.
There are 30 something.
Yeah.
That's right. Okay. Anyway, through these doors is our labor and delivery area. So any patients that come into the hospital that go into labor, you will find them here. Now we're going to head upstairs to peds.
So a lot of different ways to get over to peds. You can take the elevators behind us over there. Also downstairs there's another set of elevators, and there's one right around this corner that leads right up to the fish tank and near the pediatric playroom. So we're going to go that way.
There are like 2 fish in here. So this is our little fish tank, and then kind of through there you can see our pediatric playroom, and we'll go over to the main floor over here. Oh. Oh.
Yeah, you're building on sound.
But it's there theoretically. Excuse us.
All right.
These are the attendings and the nurse practitioners that we work with on pediatrics. Those guys over there are the intensivists that work in the PICU, and we get the chance to work with them some as well, and they are all awesome. This is the Pediatrics Floor. You spend 2 months here as an intern, just working on peds, and then kind of similarly to OB, if any peds come in who are admitted to our inpatient service, we see them second and third year here as well. We're going to go to the resident workroom. That's mainly where internal medicine and surgery work during the day. But we work there like during our ICU month as an intern, and then a lot of times if people are there on nights or things like that. There's a soda machine there and usually a bunch of snacks that we can get into.
It will take you a little bit to figure out the hospital. It's not the largest hospital in the world, but it is pretty sizable. But the great thing is that you have signs pointing you pretty much everywhere you need to go. So you'll have like the education center down there. Sometimes whenever we have like large group meetings, we'll have them in the auditorium down there. And then this way is where we're going to be heading, towards the resident lounge. The ED is down there this way too, the chapel, and also the gift shop, which is a pretty cool place. And then through here, you'll have a lot of different like posters, montages. You'll have different areas where you highlight some ancient artifacts of medicine, which I thought was pretty cool when I was going on my tour. We'll show you this later, but down here is the courtyard. So we've actually got some rocking chairs in the back. We'd also come out here for some of our lunches whenever we were, either on inpatient or if we were doing cat chats. And they even have some bags down there.
It connects.
Cornhole.
Yes, cornhole. It connects to our cafeteria that's like directly under us.
Yeah.
Way down that hall is the attachment to our behavioral health hospital. So we don't typically see patients down there, but a lot of our patients, if they need psychiatric care while they're here, will get transferred down there.
Yeah. All right, so inside is our resident workroom. In here, you'll have the internal medicine group, you'll have the general surgeons who are usually in here as well, but it's a great place to come sometimes when you're on nights or if you have any questions. Second year, when you're here by yourself and you just want to run something by somebody, great place to stop by. They always have someone in here and they're really awesome. They do have a PlayStation 4. Haven't seen it used a whole bunch, but some nights, you never know.
There's also snacks
Snacks.
and soda.
Yeah.
I'll let you know. All right. We kind of keep going towards the back here. We'll sort of pass our surgical area, but we're on the way to our actual rounding room. It's in the north tower of the hospital, which is a new shiny tower that they found us a space for. So that big tower over there is the South Tower, which was the older main hospital tower where we see patients. Still, a majority of our patients are in there on our inpatient service, but once in a while we get someone over here. They have no idea we're coming in here today. Excellent.
This is now a workspace.
Coastal Family Medicine Rounding Room. Hello. You're on candid camera. This is Caitlin. She's one of our fourth-year acting interns. This is our rounding room. This is Patel, also a second year.
How you guys doing?
Holding down the fort on our inpatient service. We have a couple whiteboards for teaching and for keeping track of patient stuff. We got 3 computers in here that we can chart on, and we have a nice couch now. It'll be fine. It'll be better. This is one of the North Tower patient rooms. They're very nice in here. They're very spacious. So this is the lobby of our 4th floor on the North Tower, and it has a really nice window view of the city. You can see the Cape Fear Memorial Bridge over there. You can see the port over here, and it's just a nice, sometimes sunny place to come hang out. I spend a good amount of time over here on my weekend 24s when there's some downtime.
All right, and we're gonna head down towards the South Tower.
And the emergency department, and the ICU, and ABP. Whoops.
All those things.
These are the elevators to the main tower that we showed you through the window over there.
So, if you go down this way, that will take you down towards the ICU. But we
those
can't
doors.
actually go in there just because they have really sick patients in there right now. So we're gonna head down this way to ABP.
And this is all of our emergency room. There's a ton of beds. This is Aubon Pan, or ABP as we call it. It's essentially a Panera type place where we have a bunch of soup, salads, and sandwiches we can get. This is the only place that's open after midnight. So when we're on a night shift or on a 24 on the weekend or on I don't think we do any other rotations at night. But if you need anything after midnight, this is the place you go.
And if you buy 4 sandwiches, you get the 5th one free.
Something like that. It's
Something
a great
like
deal. The more you know. Yum. No se puede. Oh yeah, look at the cookies. That's a real shame. I used to do a lot of those. Okay. If you go down that way farther, that's the entrance to the Zimmer Cancer Center, where a lot of our patients go for oncology care. Fun fact, the pathology lab is also over there, so any path specimens you send, all the guys reading them are over there. It sure does. Bleachy. Thanks for coming with us on the hospital tour.
Wish we could do it in person, just due to the times we can't, but we hope that you got a good view of the hospital and just got to actually see a little bit of what we've got going on here. Hopefully you get to see it in person at some point in time.
And we're excited to meet you on your interview day.
Yeah, good luck. Have a good one.
Bye!